Good afternoon, everybody. Welcome to the third session of the 2021 Asia Pacific Leaders Dialogue for Malaria Elimination, cross-border collaboration for malaria elimination. As the region moves towards elimination, it's essential to address the issue of border malaria and collectively identify ways to strengthen cross-border collaboration to ensure sustained elimination. We will start the session with video remarks from Dr. Poonam Khetrapal Singh, Regional Director for WHO Southeast Asia region, highlighting the importance of cross-border collaboration in the context of malaria elimination in Asia Pacific. Dr. Poonam Singh has more than 3 decades of experience strengthening public health systems. Before her current position, she spent more than 2 decades as a member of the Indian Administrative Services, where she managed low-resourced health systems, led large multi-sectoral teams, and collaborated with global partners and public health leaders. Dr. Poonam Singh.
His Excellency, the Honourable Prime Minister of the Royal Government of Bhutan, Dr. Lode Tshering, Her Excellency, the Honourable Minister of Health of Bhutan, Dasho Dechen Wangmo, His Excellency, the Honourable Minister of Health and Family Welfare, Republic of India, Shri Mansukh El Mandavya, Excellencies, Members of Parliament and partners, Dr. Takeshi Kasai and WHO colleagues. Warm greetings and my sincere thanks to Asia Pacific Leaders Malaria Alliance and Asia Pacific Malaria Elimination Network, in partnership with the Ministry of Health, Royal Government of Bhutan, for co-hosting this important and very timely dialogue on cross-border collaboration for malaria elimination. Last week, WHO released its World Malaria Report, providing in-depth information on the latest trends in malaria control and elimination at global, regional, and country levels. The report finds that the WHO Southeast Asia region continues to achieve the largest decline in malaria case incidence and death among all WHO regions. It shows that despite COVID-19 related disruptions, by the end of 2020, the region had met each of the global technical strategy milestones for mortality and morbidity, a tremendous achievement. It highlights that in 2020, Bhutan, DPR Korea, Nepal, and Timor-Leste reported zero indigenous malaria deaths, and that both Maldives and Sri Lanka maintained their malaria-free status. It notes that despite minor setbacks, elimination is still very much on the table in the 5 countries of the region actively pursuing it, namely Bhutan, DPR Korea, Nepal, Thailand, and Timor-Leste. 3 of those countries, Bhutan, Nepal, and Timor-Leste, are especially close. In 2019, Bhutan reported just 2 indigenous cases. In 2020, it reported 22 due to an outbreak near the international border. In 2019, Nepal reported 131 indigenous cases and 73 cases in 2020. Timor-Leste came close to completing 3 consecutive years of meeting the malaria-free threshold, reporting 0 indigenous cases in 2018 and 19, but experiencing a small outbreak in 2020. For each of these countries and more, the focus of this dialogue is critically important. Cross-border malaria is an intricate and multi-dimensional issue. There is no one-size-that-fits-all solution. For countries pursuing elimination, it must be addressed early and revisited often. It must be approached in the spirit of collaboration and in recognition of the many benefits that will accrue to at-risk and vulnerable populations on both sides of the border. The Southeast Asia region has for many years not just recognized but actively fostered cross-border collaboration to achieve malaria elimination. This is reflected first in the 2017 Ministerial Declaration on accelerating and sustaining malaria elimination in the Southeast Asia region, and second, in the 2018 Ministerial Call for Action to eliminate malaria in the Greater Mekong sub-region before 2030. It is embedded in a 2018 Regional Committee resolution that calls on all countries to operationalize cross-border collaboration, including by mapping population mobility, exchanging data information, and strengthening district programs. It has inspired an array of innovative initiatives that have since been pursued and which will be detailed in coming discussions. Though no one country or partnership is the same, countries embarking on elimination and which share a border or borders with malaria-infected countries must address several priorities. First, developing country-specific cross-border roadmaps that are based on sound, in-depth situation analysis. Such roadmaps must consider measures to improve access to healthcare, strengthen surveillance in border districts, and empower local officials for timely decision-making. They must provide strategic guidance that is clear, that is actionable, and which covers all operational aspects. Second, strengthening key capacities that enhance coverage and surveillance and which meet the unique and complex geographies and contexts of border areas. Human resources in border areas, in particular, must be strengthened and logistical capacities enhanced to effectively and efficiently deliver core malaria interventions such as case management and follow-up, vector control, and surveillance. Third, increasing district-to-district coordination and collaboration, for which dialogue, meetings, and exposure visits are key. Such collaboration should benefit countries in a way that is mutually beneficial and which strengthen capacities on both sides of the border. Fourth, strengthening buy-in for increased data sharing between countries and establishing the mechanisms by which it can be facilitated. Timely and transparent sharing of epidemiological data related to person, place, and time is critical to mounting a rapid response to clear the transmission foci. Fifth, mobilizing increased partner support for cross-border initiatives with a focus on implementing a harmonized approach that avoids duplication. Together, we must apply our resources efficiently and effectively, driving maximum impact. I take this opportunity to commend all countries and partners for their tremendous efforts to maintain essential health services, including for malaria, throughout the COVID-19 response. Across our region, worst-case scenarios have thus far been averted, and our trajectory remains strong. Together, we must catch up on pre-pandemic progress, accelerating progress towards the Southeast Asia region with zero malaria cases and zero malaria deaths, and a healthier, more sustainable future for all. I wish you engaging discussions and look forward to our onward journey together. Thank you.
We thank Dr. Singh for taking time out of her busy schedule to record her message, highlighting the issue of border malaria and the need for effective cross-border collaboration. So this session of the dialogue discusses the importance of cross-border collaboration and key strategies that can be adapted to effectively address border malaria. So for the panel discussion today, we have with us Honourable Dr. Pandup Tshering, the Health Secretary of Bhutan. Dr. Tshering was previously Director General of Medical Services and Director of Public Health and has more than 3 decades of experience in public health, health system strengthening, and health leadership. Dasho has an MBBS degree from Chittagong Medical College in Bangladesh and a master's degree in public health from the Chulalongkorn University in Thailand. Welcome, Dasho. Next, we have Dr. Health and Family Welfare India. Dr. Singh oversees the urban health mission and programs like vector-borne disease control, leprosy, and viral hepatitis. He's a qualified veterinarian with a career in more than 27 years. He has worked in various ministries and departments of the Government of India and dealt with subjects as wide-ranging as taxation, international trade, to now social sectors like health services and issues relating to women and children. Welcome, Dr. Singh. Thirdly, we have Dr. Didik Budijanto, Director of Vector-borne and Zoonotic Disease Prevention and Control in Indonesia. Dr. Didik has over 20 years of public health experience. Previously, he served as the Director of the Data and Information Center, and under his leadership, Indonesia has accelerated malaria elimination efforts and maintained them despite the limitations imposed by the pandemic. Good to see here, Dr. Didik. And last but not the least, we have Dr. Josefina Clarita Jao, the National Director of Disease Control in Timor-Leste since March 2020. She oversees 2 departments, communicable diseases and non-communicable diseases in the Ministry of Health. Dr. Josefina has been engaged in developing the National Action Plan and Strategy for Health Sector and also contributed to the development of the National Action Plan for Health Security. This panel will be moderated by Dr. Jigmi Singay. Dr. Jigmi Singay is the Executive Secretary and Coordinator for the Global Fund Southeast Asia Regional Coordination Mechanism Forum in New Delhi. He was previously Bhutan's health minister and helped to develop the system that provides health care to 90% of the kingdom's citizens. His 35 years of experience include serving as WHO's acting representative in Myanmar and the Southeast Asia Regional Office Delegate on the Fund's board. Over to you, Dr. Jigmi.
Thank you, Amita. Good morning, good afternoon, and good evening. I am Dr. Jigmi Singay, as already introduced to you by our Master of Ceremony, and I am the panel discussion sessions moderator for today. First, I would like to extend my warm welcome to our distinguished and eminent panel members, and in equal measure, welcome the audience who are viewing this panel session. As a background, I would like to reiterate what Dr. Amita has just highlighted, that this panel discussion on cross-border collaboration is being conducted to highlight the importance of cross-border collaboration and to identify key strategies to effectively address cross-border malaria. Before we begin the session, I have a gentle reminder to all our honorable panel members that all panel members are requested to respond to the questions posed to them within 3 minutes limit. So now we begin our first question, and my first question goes to Honourable Health Secretary from Ministry of Health, Royal Government of Bhutan, Dr. Pandup Tshering. Sir, Bhutan has made a significant progress in curbing malaria and aims for elimination by 2025. How important is cross-border collaboration to achieve this goal of malaria elimination? Over to you, Honourable Health Secretary of Bhutan. Sir.
Uh, Good afternoon. Am I audible?
Yes.
Okay. Thank you, moderator, for the question. Distinguished panelists, ladies and gentlemen. I think when you talk of this cross-border collaboration on malaria, I think it's also important for us to understand why there's cross-border challenges. I think it's mainly because I think there's lots of studies done across the globe, and it has been found that many times cross-border challenges occurs because there is not uniform prevention as well as treatment services across the borders. Also, I think many countries doesn't give enough importance to the cross-border in the bordering areas, so that leads to lack of access to services, mainly prevention and treatment services. So, and also it has been realized that if some country is targeting elimination, I think they will never be able to eliminate malaria unless they give cross-border collaboration as one of the strategies for eliminating malaria. Similarly, as Bhutan, I think we are targeting to eliminate malaria by 2022. I think we give very much importance to this cross-border collaboration, mainly because I think for Bhutan, all our high-risk malaria districts lies at the international border, and also we have a common where there is villages which are lying across the border, very close to the border, and also there's free movement of people across the border. So these are the I think challenges for Bhutan, but also we like to emphasize there are challenges, but also there I think we can develop some strategies which will help us to overcome these cross-border challenges. Uh, some of the strategies which has been also been successful in other countries is probably forming a high-level committee for cross-border collaboration with the neighboring countries. And at the same time, it's also important to have that conducting joint assessment of the risk, as well as on availability of services, facilities, and also behavior of the people and on the movement of the people across the border. Then also it has been found in other countries that, of course, high-level committee is there, high-level political commitment is there, but also it is important to have local level, ground level coordination, and also joint interventions in terms of prevention and also in terms of surveillance. So we know that cross-border integrated, I think it's integrated public health response will be very crucial, to improve this cross-border malaria problem. And apart from that, it's also important for countries to share data on a regular basis, especially on the epidemiology, outbreaks, drugs and insecticide resistance. So this, I think, sharing of data is also important for coordinated intervention along the border. Now, for specific to Bhutan, I think we share a very close border with our friendly country, India. And also Bhutan and India, I think, has age-old development partners who share very traditionally close and very friendly relationship. So we also know that as we Bhutan is targeting 2022 as our elimination target year, at the same time, India, on the other hand, is also, I think, committed and moving in a phased manner towards elimination by 2030. So in light of these national goals, effective tackling of this cross-border malaria between India and Bhutan will greatly benefit elimination goals for both our countries. So also, I think in the past we did have number of cross-border collaboration meetings on malaria elimination, and a number of recommendations has already been has come up. And one was, I think, to have the joint plan of action. And we also have that, I think there's high level commitment is there at the highest level, but translating that actions into ground level is also, I think, is a priority. Now, we also, I think there's also a recommendation to have this joint plan of action implementation. Therefore, this may be given a priority and should be backed by strong monitoring and evaluation mechanism framework. And also to strengthen the local level coordination, I think there was also recommendation that there should be identification of focal person on both sides of the border so that they will be able to coordinate the prevention and other effort at the local level. And also, I think recently there was also a virtual meeting between the officials of the two countries where they have agreed that maybe 5-kilometer buffer zone along the international border be synchronized for implementation of the malaria activities. Further, I think in order to improve this cross-border collaboration, not only between for Bhutan, but also overall in the region, I think we need to have the technical expertise from WHO, the APALMA, and the APMEN. No, we should have the regular platform like this where we can share. There should be a platform for technology, knowledge, and skill sharing, so that we strengthen our cooperation and collaboration. And also now we hope that putting all these strategies in place will enable to strengthen our cross-border collaboration for the malaria elimination, as well as we hope that both Bhutan and India will be able to achieve our elimination targets on time. So for now, I think that is my comment. Thank you, moderator.
Thank you, Honourable Health Secretary from Bhutan, for highlighting all the issues related to the problems of cross-border collaborations, and at the same time highlighting that it is really critical for the malaria elimination. Now, my next question goes to Honourable Joint Secretary of Health, Ministry of Health and Family Welfare, Government of India, Dr. Harmeet Singh. Sir, in the context of India and Bhutan, what are some of the sustainable strategies that can be adopted to eliminate border malaria? Kindly tell us, what are some of the challenges with respect to implementation of these strategies and how we can mitigate them? Over to you, sir, Honourable Joint Secretary.
Before coming to the matter of Indo-Bhutan border on malaria, sir, first of all, I would like to inform you that India is celebrating 75th year of completion of our independence in 2020. And this occasion we are celebrating as Azadi Ka Amrit Mahotsav all over the country. Now, after the 75 year, we are looking back in all sectors in our country from where we were at the moment when we got the independence and where we have reached now. So in this context, when I see the malaria scenario, so in 1947, we had a population of 330 million only. And in that year, sir, the number of malaria cases was approximately 75 million at that point of time. And the deaths were also 0.8 million in those era. But looking back in the 75 year, we have brought the number down to 0.18 million in 2020, and this year further reduction 0.126 million, and number of deaths has come only to 65. You can see the journey that India has moved from 47 to 2021, coming down to 80 lakh death, 8 lakh death to 65 only. And secondly, sir, for us, this is not a standalone issue. It is part of our overall strategy to bring the malaria down. When the Appalma came into existence for last 5-6 years, even for this period, if I see the achievement of India is quite impressive. And in this period, we have got the reduction of 84% in morbidity and 76% in mortality. And India's achievement has been appreciated in the World Malarial Reports that is published in the last previous years. So we had prepared national framework for elimination of malaria for 16 to 30, and we are all committed to the joint regional goal of eliminating malaria by 2030. I endorse, but Dr. Tshering had just mentioned between India-Bhutan border. So, India and Bhutan share a border of 699 kilometers, almost 700-kilometer long border, and 4 Indian states, Arunachal Pradesh, Assam, West Bengal, and Sikkim, we border, and we have 9 districts which are bordering Bhutan. In all these 9 districts, we have annual parasitic index which is less than 1 in 1,000. 1,000, yeah. And in 2 districts, we have already achieved the 0. And even for 3 districts, it's in the range of only 0.01 to 0.03%. So the scenario on Indo-Bhutan border is also quite impressive, sir. So the measures, the strategies, Dr. Tshering has already spoken. So I may not, I only endorse what he has said. So we have held joint meetings, we have mechanism. And yes, there is need for the collaboration at the local level authorities on both the sides. So we can have mapping of the health facilities on both the side of borders. And in fact, we are already an informal communication in the form of setting up WhatsApp group, etc. Also, because India and Bhutan, we are having open border and there is free movement of people and free trade also. So these type of measures, I think, can help. And regarding the challenges, I see there may be some coordination issues at the local level, but I don't think there is any big challenge. And if challenge is there, it is no bigger than our commitment. So commitment is much bigger than the challenges. So therefore, I hope we will definitely be achieving, and we are on the right track to achieve our joint regional goal for this. Thank you.
Thank you so much, Honourable Joint Secretary, for a very impressive and comprehensive statement on the strategies that are existing, and also the underlining that Sir has given is that commitment is much, much more than the existing challenges which are within the control. And it is a very encouraging and positive statement for the India and Bhutan cross-border area, and also already works are under progress for how these challenges are being kind of resolved. Thank you once again, sir. And my next question is to Madam Dr. Josefina Clarita Joe. Madam, Timor-Leste is part of E2025, a WHO initiative which aims at achieving malaria elimination by 2025. How critical it is for Timor-Leste to tackle border malaria in order to achieve this goal, and what are some of the current efforts put in place? Over to you, Madam National Director General of the Disease Control of the Ministry of Health, Timor-Leste. Over to you, ma'am.
Thank you very much, sir. Good afternoon for every one of you. First of all, I would like to thank the organizer to have this very important virtual meeting. And before I begin, I would like to share with you an overview of our border. Timor-Leste and Indonesia share a land border on Timor Island, where the west part is Indonesian, belong to Indonesia, and the east part is belong to Timor-Leste. We have three municipalities such as Bobonaru, Kobalima, and Enclave Oikusi that share border with Indonesia, East Nusa Tenggara Province, while Atauru Island separate by maritime border with South Ambon of Maluku Province. It's Lira Island. Timor-Leste has made tremendous progress in a short span of time and is close to apply for WHO malaria-free certification. We have zero mortality since 2016 and zero indigenous case since June 2017, 18, and also 19. However, during the COVID-19 pandemic, there were 14 malaria cases reported in the country last quarter of 2020. Among these 14 cases, 10 were reported from Sitrana village that locate in the border in the far west of Enclave Oikusi, and 3 from that cases were classified as indigenous cases. The major challenge, the critical issue we've identified and facing are due to land dispute at border among Sitrana and Naktuka is still not finalized among the government of Indonesia and Timor-Leste. This circumstance was benefit for population to pass and facilitate to transmit malaria and other contagious disease at any point of time. There is a lot of regulated movement across the international border among West and East Timor, resulting in malaria importation to Timor-Leste. This illegal movement still high even during the COVID-19 pandemic lockdown period. The social, economic, and cultural development lags behind the cross-border from one side to other side. Despite substantial effort to make cross-border cooperation operational, the border malaria remains the issue, making the malaria-free status of Timor-Leste vulnerable. Malaria surveillance in the point of entry has not well regulated, and lack of the implementation due to the limit of health professional. Surveillance in the uncontrolled border areas where illegal migrants are crossing the border. Lack of implementation of the agreed cross-border joint action plan for malaria elimination 2019-2020, such as foci investigation within radius of 1.5 kilometers at each border municipality and district due to the COVID-19 pandemic. The joint action plan was mostly covers sharing of the data, needs assessment, technical implementation on malaria elimination, including surveillance. Lack of coordination and follow-up meeting between both countries due to COVID pandemic, even though the communication network was set up through WhatsApp group platform, between malaria focal point from both countries. We have some specific strategy for Timor-Leste in relation to reduce the malaria transmission in the border area. Some intervention such as surveillance with the activity of notification of cases within 24 hours, also sharing notification of the case to NTT, program manager, case and foci investigation carry out and entomology investigation, routine active case detection to the proactive case detection using RDT by the health volunteers and SAM-based management, reactive case detection, and also activities in integrated drug resistance like resistance surveillance, entomology in trend observation, focus investigation, spot survey, insecticide resistant monitoring, and in vector control, doing routine indoor residual spraying, focus indoor residual spraying, continuous LLINS distribution to target group, mass campaign distribution of net tourist population, larval source reduction of modification, LLIN use monitoring by the health volunteer, quality control and quality assurance bioefficacy test for insecticide use. And this, our target is to all the location where the case is detected, population who are living in the border areas, migrant national and international, security for student agriculture, height vulnerability and receptibility, health centers and point of entry, also border areas where lack of health facility and height movement of the population, and 1.5 kilometer radius from the infected malaria patient within 5 days. Recently, the Cross-Sector Development Partnership Initiative has developed the concept note from Timor-Leste NTT Indonesian Malaria Elimination, Accelerating Malaria Elimination Timor Island 2024 and Nusa Tenggara Timur 2026. The aim is to achieve the sustained accelerate malaria elimination across two geopolitical entities. And also, Timor-Leste also has the highest level commitment on malaria elimination since our own Prime Minister became the leader of our national task force for malaria elimination in Timor-Leste. Over to you, sir.
Thank you, madam. Thank you very much for highlighting the current situation of the cross-border situation faced by Timor-Leste. It's been very heartening to note the political commitment and the activities that you have undertaken this. Now, thank you. And now my next question goes to Dr. Didik Budijanto, the Director for Vector-borne and Zoonotic diseases for the prevention and control from Indonesia. Over to you, Dr. Budijanto, please. And the question is, the Indonesia and Timor-Leste have been engaging in cross-border efforts for communicable diseases, including malaria, since 2017. Drawing lessons from the formal mechanism between the two countries, what are the challenges and gaps in coordination, and how can we overcome them to improve cross-border coordination between the two countries? So this is the question, Dr. Budijanto. Over to you, sir.
Thank you, Dr. Jigmi. Good afternoon, everybody. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to thank Apama government for the opportunity to represent Indonesia in this very important cross-border collaboration panel session in high-level dialogue, a strategic regional event like this. Greeting and thank you for you to the moderator, Dr. Jigmi Singay and Ms. Amita JB for the warm welcome. Warmest greeting to our distinguished panelists from Bhutan, India, and Timor-Leste. Last but not least, I would like to also greet all honorable participants joining this panel discussion. Yes, back in 2017, Indonesia and Timor-Leste signed an MOU and joint action plan. All goodwill were put on paper and agreed upon in 2019. The plan was evaluated. However, unfortunately, since early 2020 until now, we have been compelled to shift our focus and effort to the COVID-19 pandemic. That somehow slowed down the activity related to cross-border collaboration. Thanks God, we have gained more wisdom and experience. Now we can focus on taking care of the COVID-19 pandemic while also paying enough attention to other disease control. We just restarted Indonesian Timor-Leste cross-border collaboration activity in collaboration with WHO and HSPA RAM Apama. We are ready to continue with our Indonesia Timor-Leste cross-border collaboration. The question from our distinguished moderator is just on time. We need to look back and learn from our experience as we are restarting. What are the challenges and gap in coordination and how we can overcome them? As a background, let me explain that, as you know, Indonesia is an archipelago. The Indonesia-Timor-Leste border is in Timor Island of is entity is Nusa Tenggara province. Yeah. Geographically, it's relatively far from Jakarta, the capital city of Indonesia. It is on a different island. Within such a geographical context, in daily practice, coordination may seem to be much easier between national government of Timor-Leste and provincial government of entity. However, one must not forget that cross-border between countries involve relationship and collaboration between two countries. International cooperation like this is the authority of national level government, not provincial government. Therefore, coordination must start from national level of both sovereign countries before it is followed up at subnational level. Indeed, for such condition, clear mechanism must be agreed in advance. It must be clearly described in the MOU and joint action plan. All parties involved in cross-border initiative, including donors, must appreciate this and comply to agreed mechanism. Otherwise, coordination may stumble and could block the whole initiative. Clear standard operation procedure for day-to-day activities also must be developed together. This document should be described the roles and responsibilities of the provincial and district governments. It should also describe the reporting procedure to national level. Second lesson, we know that besides formal, we monitor cross-border rule. There are many traditional cross-border poros and split in many villages. These routes are very hard to monitor. Thus, it is very challenging for population migration surveillance. We need to understand that the people of Timor-Leste and the people of Indonesia in west side of the island are from the same ancestor. Most of them are relative close or far. Traditional cross-border routes are unavoidable. It is very important to find strategies to implement friendly population migration surveillance and other disease control measures in this family backyard cross border. Timorese and West Timorese have been exchanging ID card for the purpose of accessing health services. East Timorese may have access health services provided by Indonesia and vice versa. This is a very delicate issue. In this issue, disease control measures must be the priority. We need to find friendly solution too. The specific challenges need specific out-of-the-box strategies. We shall make sure that these issues are accommodated in the new MOU. Thank you very much. Over to you, Dr. Jimmy.
Thank you, Dr. Budijanto, for highlighting how the lessons learned from the ongoing MOU and what lessons will have to be this, how it will be used in the next MOU that has to be done. Honorable panel members, with this we finish the first round of questions. And before we go to the second round of questions, my earnest request, please limit to your time of 3 minutes. We have far exceeded the time that was allotted for this panel discussions. So with this request, I'm now going back to our first, my question to Dr. Pandup Tshering, Honourable Health Secretary from Bhutan. Sir, the COVID-19 has stretched thin system of our countries. But on the flip side, it has evolved the system, our system, particularly when it comes to surveillance, such as digitalization and real-time data. Can this system be leveraged to support cross-border efforts to tackle border malaria, and how? Dr. Pandup Tshering, please. Over to you, sir.
Thank you, sir, for that question. Definitely, I think after the COVID-19 pandemic came, I think in Bhutan, where one advantage that we were able to take was that we were able to make use of this IT system. So, like for example, we developed the health facility system. We also developed the Bhutan vaccine system, the checkpoint management system, and also the Duke Trace app. So this system helped us to get immediate information in terms of surveillance, in terms of contact tracing, in terms of quarantine. And I think during the vaccine, our nationwide rollout of vaccine, I think we were able to use the Bhutan vaccine system, which enabled us to give up-to-date information, real-time information on the number of people vaccinated, number of adverse events during vaccination, and also the vaccine stock, and also overall coverage we are able to determine on a regular basis. So considering the advantage of this system during the COVID-19 pandemic response as well as during our vaccination, I think such system can be definitely developed for our cross-border collaboration strategies. So this will help us, I think, in sharing information between the bordering two countries in terms of the epidemiology of the disease, in terms of the, in case there is an outbreak, in terms of outbreak of disease, malaria, as well as in terms of resistance insecticides, or as well as this medicine resistance, as well as in terms of if there's a mass movement of people across the border. I think if you have such a system for cross-border collaboration, I think it will enable us to share immediate information on malaria, so that we can also take action, intervention, coordinated intervention across the international border. I thank you very much. I think I have to keep to the time. Thank you.
Thank you very much, Dr. Pandup Tshering, for your very positive comments and how you see that these things can be leveraged. Now, my next question goes to our Honourable Joint Secretary, Dr. Harmeet Singh, from the Ministry of Health and Family Welfare, Government of India. Sir, a strong sense of commitment and cooperation exists between India and Bhutan. And this you highlighted also during your first intervention earlier. And a perfect example would be India's neighborhood first policy. How this and other such policies can be leveraged to strengthen the cross-border collaboration for malaria elimination between the two countries. Over to you, sir.
As you rightly said, we have a policy of neighborhood first. India believes in peaceful coexistence, and we maintain the peaceful relation with our neighboring countries. Not only maintaining the because peace is the first requirement for road to prosperity. That is our belief. So we indulge in collaborative, synergetic co-development with our neighbors, and our cooperation has wide range of subject, from economy, from technology, research, education, health sector, all walks of our life. And the Bhutan especially enjoys a special relationship with India, which you can be seen from the fact that our Honourable Prime Minister, after swearing the ceremony, Bhutan was the first country he visited. So, this policy is a complement to the Look East policy of the government. So, I think this policy, as well as similar such forms which we have, like SARC or BBIN, they can be utilized to keep the dialogue going on continuous basis at the political level, administrative setup level, and most importantly at the people to people level. So as I said in the first question, with Bhutan we have free movement of people, free trade, open borders. So but I'll wind up in one line saying that the dialogue uh, on the malarial, now right now we are focusing on the malarial issue. On the malaria or other such pandemics, if any occur at any point of time, or other health issues, they should form an integral part of the all summits or international meetings that take place on the sidelines of that conference. Apart from the political and other issues, the health sector as such, and malaria particularly for us, so that should be forming the part of the continuous dialogue between the neighbors. Thank you.
Thank you, sir. Thank you very much for your very, very heartening highlights of points on the policy issues that you have given. And what has been very impressive has been on your comments, people to people, and the free movement that exists, and a continuous dialogue that needs to take place, within the overall health chapter, the malaria to be given priority along with the neighborhood and the neighboring countries. And it's very heartening to note that. And with that, I would like to thank you again. And now my next question is to, again, Madam Dr. Josefina Clarita Yao, National Director General for the Disease Control, Ministry of Health, Timor-Leste. Ma'am, in the context of Timor-Leste and Indonesia, what are the sustainable strategies that can be adopted to eliminate border malaria? What are some of the challenges with respect to implementation of these strategies and how we can mitigate them? Over to you, ma'am.
Yes, sir. Thank you again. That's a very excellent question. Since January 2021, Timor-Leste has adopted and implemented the new strategic plan of prevention of reestablishment of malaria in the country from 2021 to 2025. Through the launch of E2025 initiative to sustain commitment while the 2020 goal is now gone, revisiting the goal to E2025 gives an opportunity for us to maximize on the great progress made to date. Commitment to sustain malaria intervention despite COVID-19. Every health facility in border areas and mainland should carry out screening of the travelers who are coming from outside the country, especially who comes from the country with high burden of malaria. Advocacy on the importance of prevention of malaria reestablishment for different target, local leaders, relevant institutions, universities, and security force to participate in preventing the reintroduction of malaria in Timor-Leste. Transition of the malaria officer to be absorbed in the government state budget in near future. We have committed by 2022 71 officers funded by the global funds currently will be integrated to the government, and the tax and responsibility will be expanded to vector-borne disease control. With country coordination mechanism oversight committee since last year, and this year we have conducted joint monitoring to municipalities, sub-municipality, and the community in order to identify the challenge in implementation of malaria, TB, and HIV programs, and discuss with all the health professionals how to overcome those challenges and conversing the decision makers to think of investing fund from the domestic funding in the future by phased manner. Implementation of the recommendation given during the external review and malaria elimination assessment to improve the implementation of POR malaria in the country. Finally, the National Malaria Program will maintain the implementation of existing strategic plan for us to achieve our goal. So we will maintain all the activities and strategies for cross-border areas as mentioned earlier to be implemented in order to sustain the zero malaria in the country. Thank you very much, sir, and over to you.
Thank you, madam. Thank you very much for so many programs and projects that are already put in place for achieving your 2025 goal. And with that, now I would like to go pose my next question to Dr. Didik Budijanto from Indonesia. Sir, how important it is to engage stakeholders at the subnational, meaning provincial, district, village level, to ensure effective implementation of harmonized cross-border efforts, and what role partners such as donors and technical partners and communities can play in ensuring sustainable cross-border efforts in the context of Indonesia and Timor-Leste. Sir, over to you, Dr. Budijanto.
Okay. Thank you, Dr. Jim. Yeah, you know that in the Indonesian governance system, authorities and responsibilities are divided. For any issues, including head, there are authorities and responsibilities that belong to national government, and there are authorities and responsibilities that belong to provincial, and to district, and to village governments. There are no gaps nor overlaps. These divisions are clearly described in national regulation. In all issues of governance, strong teamwork between national and subnational is the key to success. The teamwork is guided by the earlier mentioned national regulation that regulate the different level of authorities and responsibilities. For disease control issues, it is indeed crucial to engage subnational level stakeholders. There is already existing head team which consists of stakeholders from all levels. The teamwork in harmony, each level playing specific roles that complement each other. On the other hand, under the Ministry of Foreign Affairs, there is also a team involving stakeholders from national and subnational level from cross-border issues at large. As related to cross-border disease control, the two teams work together at the national level as well as at subnational. Cross-border malaria elimination effort need to involve multi-sectoral, multi-level teamwork. This engagement and involvement may sound complicated, but it is actually not. It just needs clear mechanism and standard operational procedure, SOP. Let me give all of you clear example of the different rules of different level of stakeholder. This level stakeholder and community is a key stakeholder for population migration surveillance. There are significant, especially around traditional cross-border route. District is frontline implemented through the primary health center that is located in very sub-district. The primary health center provides standard malaria diagnosis and treatment and conduct malaria surveillance, including case and epidemiological investigation of day 1 notification, day 2 investigation, and day 5 elimination response. Provincial level has the coordinating role and the provide technical direction national level, ensure technical soundness, shortness, and provide strategic direction. In conclusion, for our health programs, including cross-border malaria elimination program, solid teamwork between national level and subnational level is always the case and is the key to success. There is already national regulation for this. All donor and technical partner need to understand this. Technical partner may provide necessary technical assistance, while donor may provide funding support, but both must be based on real needs on the field, not based on any specific interest or agenda which is not shared by the countries. They need to understand the different governance system between countries. and procedure. Thank you very much. Over to you, Dr. Jimmy.
Thank you so much, Dr. Budijanto, for stressing and also really highlighting how important this involvement or engagement of stakeholders, partners, and the communities at all levels are so important for the success of the cross-border collaboration and also the disease. Indeed, this is very important message you have given us, and also very heartening to note how things are progressing, are being implemented in Indonesia. With this, honorable panel members, we come to the end of our question and answer session or panel discussion. And now I think we will go to our next session announcement. So I hand over this to Dr. Amita. Over to you, Dr. Amita, please. Thank you.
Thank you, Dr. Jigmi. Now we've come to the end of this session, and we would like to once again thank Dr. Singh for her opening remarks, our esteemed panelists for sharing their context-specific solutions, and also importantly for keeping good humor despite the technical challenges. And finally, our moderator, Dr. Jigmi, thank you for a very engaging session on the importance of cross-border collaboration for malaria elimination. I request all participants to return to the attendee hub and tune in for the next session. Thank you.